Good afternoon, everybody. Today is June 3rd, 2022. My name is Scott McGann with the Falmouth Health Department doing our weekly COVID-19 update for Falmouth. If you need to email us, it's health@falmouthma.gov, and our phone number is 495-7485. So 4,775 PCR tests since the beginning of the outbreak pandemic. 65 confirmed PCR. Again, this is just confirmed PCR, not home tests. 21 probable, which are the rapid, not home tests, the ones you get like at Convenient MD or the pharmacies, that are done by a technician, not done at home or done by the individual. Those numbers are unknown. Eventually I think it was time to stop posting a case count. I don't like posting inaccurate information. I guess it's accurate in terms of being confirmed cases, but it's not an accurate necessarily indicator. But what it can tell you is whether you're going up or down. It's just not going to give you an actual real number. Our incidence rate went from 46.7 to 40.3, still on the high side. Again, it's capturing the time frame that's capturing. It's posted by the state on Thursdays is 5:15 to 5:28. And our positivity dropped, actually basically almost stayed the same at 9.49. Case counts of the last 3 weeks are on the downward trend, which is good. I'll skip through this. So essentially, we still remain high, 209.4 per 100,000 case count in the 7 days. You need to be less than 200. We were, I think, somewhere around 264 last week, so it's a downward trend, which is good. New admissions per 100,000, you need to be less than 10 to get into the medium, between 10 and 14. We could be in the medium between 10 and 14 and the 4%. So it's the case count. So next week, if we drop anywhere near like we did last week, we would be fewer than 200. We could be in the yellow. Still, if we remain above 10, but less than 14.9% with this number, that's 12.7. That's new admissions per 100,000. So county has about 220,000. So that's about, let's say, 26, 27 people over 7 days. And so that needs to drop below 10 per 10. Well, to get to green, sorry, I'm confusing. To get to green, you'd have to be below 10. To get to yellow, you'd be between 10 and 14, which we are. And these both hospitalizations were at the yellow. We just fell a little high on the case counts. If that, again, it drops below 200 and these two numbers stay, we'll get a little bit lower and go up a little bit. Then we would be in the medium category, the yellow category next week. So my guess is would probably be yellow in the way the trends are sort of working with case counts over the last couple of weeks. But we do remain high for this particular past week. As far as what to do, again, immune-compromised people always should consider masks, your individual health status, if you're a caregiver for them as well. And when you're high, the state's not bought into, giving us requirements for this, so we don't have any requirement, but they talk about wearing, especially indoor, wearing masks, especially, again, immune compromise, and consider anybody wearing a well-fitting mask when you're at high. So that's kind of what the CDC guidance is. In terms of hospitalizations, it's sort of slightly turning downward, like we saw, going from like 14 per 100,000 to 12.4. This is a slight downward trend. It had this particular sort of bump that we've had in cases doesn't get anywhere close to where we were the original January Omicron, or back when we had the Delta issues back in the winter of 21. So the two Januaries we had these much bigger spikes. And that seems to be leveling off and heading downward. Statewide, I think it was about 3,000 something cases last week for the same day last week, 2,561. Again, PCR tests. This is not counting home tests. And the deaths were 24 for that particular week, and the positivity for this time frame was 7.29. The trends are on the downward, which is good. MWRA, which actually measures viral particles in the wastewater. It's hard to read this large chart, but it can tell you the spikes relative. Omicron was just the original one, and January was just off the chart. But if you look at these two, this is the north system in green and the south system in orange. You can see it's still a downward trend in the south system with an upward trend over the last week for the north. And so But by and large, though, again, not anywhere near the bigger spikes that were coming down at the end of January. So this is some number that was up higher. As far as incidence rates, this would be the time frame from the 15th to the 28th. All of Massachusetts had an incidence rate per 100,000. Again, incidence rate is leveled off. These are all leveled and adjusted for assuming they had the same population of 100,000. All of Massachusetts was 42. Falmouth was 40.3, so we were slightly under the state average, but higher than most of our peers. Usually we fall somewhere in the middle. So we're still a little bit on the higher side, than we like to be, and sort of average for the state, and a bit higher than quite a few of the other communities in Cape. We're on a downward trend. They're on a downward trend, but that's where we are for this one. Percent positivity, state was 8.44. We were 9.49. Still on the higher side, middle to higher side of the county right now. As far as cases, again, I like to show this chart every week. Fully vaccinated individuals, this number is barely stable, 1.6% hospitalization rate among breakthrough cases. So 9,264 breakthrough cases out of hospitalizations of breakthrough cases for 530 cases is 1.6%. The death rate is 0.51 of anybody who's gotten a breakthrough that have been vaccinated. On the far right, the numbers are obviously quite lower because that's the entire population of all vaccinated people. Obviously, it's going to be lower because all those that didn't get the breakthrough. So those numbers are much, much lower. But if you get COVID and you've been vaccinated, the hospitalization rate's 1.6% in the state, and that's pretty stable. That number's been relatively stable between 1.4 and 1. It used to be 1.8. This is the highest I remember seeing it. And 0.5, 0.4% death among vaccinated. Booster doses, nothing has changed for booster doses. We did still, again, anyone over 50 can get a second booster at least 4 months after the first. And you can do it between 12 and 18 to 50 based on certain medical conditions, again, 4 months apart, and you can mix and match. Plenty of slots. Checked again this week. There's plenty of slots if you want to get a vaccine. Whether it's your first, your second, your first booster, or your second booster, there's plenty of open slots available. Pharmacies, my primary location, go on vaxfinder.mass.gov. And anybody who's homebound, again, if you just came back to your home and you were traveling and you were here in Florida or in California or wherever, and you're back here for the summer and you notice a neighbor and you talk to your neighbor who's kind of homebound and hasn't been out, you can call that health department number. We'll make touch with the person and we can send the VNA, the Visiting Nurse Association, out to do a vaccine. So we still have the homebound program available. As far as testing, home kits are what most people are using. Hospital still does the tests. Convenient MD and the pharmacies are also still doing tests. You're not going to see many county testing anymore. They've pretty much shut that down. There's plenty of testing available elsewhere, especially with the home kits. Just remember the home kits are not going to be contact traced by us, and they're not going to show up in the numbers, but they are a good tool to use, especially among a healthy population, you and your kids or something of that nature. As far as vaccines for the week, 157. I think we were 158 last week, so pretty consistent of vaccinations per week. So that's why we have plenty of slots. I think people who wanted a vaccine have been readily able to get one, and it looks like 35 people, and according to the state's numbers, decided to get vaccinated for the first time, and 75 people got booster doses. As far as what variant we have, the BA.2.12 is the one that is now the majority. The original BA.2, which was more March, April, and then the original Omicron is still around at a much less rate, 5% or less. It hasn't gone away. It looks like about 5% or less. But what caused that giant spike that we had in January? So. As a review, case counts have been better over the last few weeks. It's still on the high side, I would say, because again, there's a multiplier with home kits. So if I'm telling you there's 50 PCRs, there might be 150 actual cases, something like that. So we don't actually have accurate case counts. We just can compare it to itself. And so compared to a PCRs of previous weeks, we can say that we've had, a modest downward trend with cases. There's still plenty of vaccine and testing capability. Boosters are available. There are no mandates. The only advisory is on town-owned property. There's an advisory from the select board, but there is no actual mandates for mask wearing when it comes to just sort of the general population. The only place you'll see masks that will be required are going to be medical facilities at this point in time. So that's my update for the week. It's pretty similar to last week. Hopefully the cases just keep dropping down, and that's it for the week, and we'll do this again next week. Thanks.